Treatment of depression is hard work and necessary. If you want to live your best life, don't be afraid to ask for help. Talk therapy is very helpful in addressing the negative thinking that comes with depression. Depression really alters how we think. We look at things in a much more negative way. We look at things through this very dark lens, and psychotherapy helps us challenge those things.
There are various different types of psychotherapy that include things like psychodynamic psychotherapy, interpersonal psychotherapy, cognitive behavioral therapy, and truly, many therapists use pieces of all these different types of therapy in their office to address what it is that the person in front of them needs.
Exercise is hugely effective for mood. Actually, it's found that 30 minutes of intense exercise multiple times a week goes head-to-head in studies with antidepressants for mild to moderate depression. Sleeping well, eating well, those are important things when you think about major depression.
The ideal treatment is a combination of medication and psychotherapy. That's been shown to be the most effective for people that are suffering from depression.
While the most commonly used antidepressant is probably the serotonin selective reuptake inhibitor, there are also serotonin norepinephrine reuptake inhibitors, which we use. Some older medications that we use include tricyclic antidepressants and monoamine oxidase inhibitors, but they tend to have more side effects, so we generally stick with the newer medications like the SSRIs.
Some work better for agitated depression, some work better for typical depression, some work better for atypical depression.
And I'm so grateful for medication because it's a very powerful intervention.
Depression is considered severe when the person is not able to function in their life. They're not able to hold down a job. They're not able to have a relationship. They're not able to have friendships. They're really not able to enjoy life in any way. Those are markers of severity, as well as self-harming behaviors, when they're using alcohol or drugs to harm themselves, as well as, of course, suicidal thoughts or actually making a suicide attempt.
ECT, or electroconvulsive therapy, is a form of treatment for depression in which a small, very slight seizure is induced that can change the brain chemistry in a way that will be helpful to treat depression. And oftentimes this is a treatment that is used if medications and therapy aren't working, and it tends to be incredibly effective.
Any sort of treatment for depression takes some time. Most medications that address the serotonin issues that you have to help you feel better take 4 to 6 weeks to kick in. And most therapy is gonna be up and down. Some days you're gonna feel great and go to therapy and feel like I have nothing to talk about, and other days you're gonna have so much to talk about. Stick with it. The more you stick with it, the more skills you learn, the better you feel, the more set for life you are. If you ever feel like you wanna hurt or kill yourself, call your doctor or nurse and tell them it's urgent. Call for an ambulance or 911, go to your local emergency room, or call the National Suicide Prevention Lifeline at 1-800-273-8255.